Lisa thought a simple surgical procedure would solve her minor incontinence issues, but an implant of vaginal mesh has proved a nightmare.
There hasn't been a month that goes by where I haven't needed to see my GP, where I haven't needed a scan or a procedure of some description. I was beginning to think that I was alone. I was beginning to feel like some sort of hypochondriac, and I'm not. I don't need to question myself. I know what is happening in my body, and I know that what is happening in my body isn't right.
Vaginal mesh is a plastic net or tape implanted to treat a variety of conditions that are often the consequence of childbirth, most commonly stress incontinence, but also to support organs that have prolapsed. One form of that is vaginal wall prolapse. This is when a woman's bladder or uterus or bowel has dropped down, pressing into the vagina. The mesh acts like a sling to hold those organs up in their correct positions. But today, NICE, which issues best practice guidance to the NHS, says it should no longer be used for this purpose, the only exception being if it's part of a research study.
This is a really important step, NICE saying that mesh shouldn't be used for pelvic organ prolapse is in line with moves that we've seen in Australia. It's a huge step forward.
NICE's change of stance still allows most uses of vaginal mesh to continue. The Medicines and Healthcare Products Regulatory Agency says we recognise some women do develop serious complications. We also know many women derive benefit from these surgical procedures for what can be extremely debilitating conditions. Figures suggest 1 in 15 women who have mesh implanted later undergo surgery to have it extracted due to complications, and more than 800 are now suing the NHS or the manufacturer.
A lot of women did not really get listened to at the very beginning. Increasingly now their voice is heard and people are taking notice, and I think there's no doubt it requires that sort of degree of response from all of us, not just in the profession but also from industry and from government.
The authorities are urging patients and professionals to report all complications in the hope of forming a clearer picture of the benefits and the risks of these implants. Catherine Jones, 5 News.